Hi, I'm Mackenzie, and this is Dr. Scott Christie, and welcome to another episode of True District's Injury Prevention Series. In our first episode, we talked about lower body injuries, in specific how to strengthen our ankles. This episode, we're going to talk a little bit more about the knees and how to prevent injury there. Scott, can you tell me a little bit more about it?
Yeah, so I think the easiest thing here is like the knee joint really only moves for all intents and purposes like a hinge. So it'll just bend and it'll straighten. So I think it's important that I'm not bypassing the knee, but we're going to move into the hip. So if you take a look at the first episode, a lot of the stuff we do for the ankle will help the knee. The stuff we're going to show you today with the hip is going to help the knee. And it's just because that the lower body and the calf muscles, they cross the knee joint. The muscles coming from the hip and thigh also cross the knee joint. So basically the ankle and the hip are responsible for controlling the knee.
So in our first episode, we talked a little bit about stability, mobility, strength, and power. Can you tell us how we can prevent injuries in our hips and our knees in regards to those four categories?
Yep. So the first time, when we were in the first episode, we were looking at stability around the ankle. A lot of that stuff will also give you stability around the hip. So what I wanted to work on today is some of the things that maybe we can add that are a little bit more specific to the hip, but you should still take a look at the first episode and work on those stability exercises for the ankle because they will afford you some benefit for the hip. So the first thing that I want to do is just put you kind of in an airplane position, okay? And I know I'm putting you on the spot because I didn't even tell you what I was going to do, but go into the airplane position. And if you get this a little bit wrong, it's okay, we're going to understand. What I want you to do, and I'll kind of help you with your balance for now, is you're going to rotate your shoulders and hip towards the ceiling. And then you come back down. And then back up towards the ceiling and back down. Okay. So a lot of the stuff we did in the first episode was standing on one leg and then kind of going in different positions. Mm-hmm. Now we've just chosen a different plane to do the hip. The other thing we'll add in is coming back to the single leg stance where I want you to actually turn and then close back up. And you don't need to do that because obviously they can see what we're doing here, but that'll add. So you have all the movements to do with the ankle, you add in a little bit of rotation, and you add in the airplane exercise, and that'll give us pretty much covering the majority of the hip joint for stability. And then once again, you can do this stuff with the eyes open, and if you're really good at it, you would start incorporating using the eyes closed. For mobility, we want to take a look at trying to make sure we increase flexibility around the entire hip. But before that, we talked a lot about differences in flexibility in the first episode. So one of the things I want to do, which is fairly simple, because we've had a discussion off topic or off camera about flyers will have one leg that's more flexible than the other, and I agree with you, but that shouldn't be the case. When we're trying to do these things, we're trying to get the same flexibility on both sides. So maybe we'll take a look at your hamstrings first just to check to see if there's any difference in flexibility. So if you just want to lie here, I'm not going to help you. All I want you to do is keep this knee locked out, and you're going to bring this leg all the way up as far as you can. Okay? And then bring it back down, and then I want you to bring the other leg up as far as you can. So right here, we're looking at the other leg probably got to around here, this leg gets to here. So there's a significant difference between the two. And research will tend to point that when you have differences like this increases your risk of injury. Okay, so basically right now we can do that through every angle, but you can go have a therapist or a healthcare practitioner go and measure to make sure that all your hip muscles have the same flexibility on the left side and the right side, front and back. Okay, so what we'll do is we'll get back up and we'll kind of discuss how we're going to go through some of this. Okay, so the first one we're going to do is we want to stretch out the hamstring. And if you don't have a lot of equipment at home, to me the easiest thing is just to have one leg out in front of you, push your hips back, keeping your back flat. So maybe if you just kind of face this way, you'll put one leg out in front of you, keep your toe flexed up. You're going to push the hip back, keeping a good posture with your back, and you keep going forward, keep pushing your hip back, and stop once you feel the stretch here. So this is one of the simplest ways to do a stretch for the hamstrings if you don't have any equipment with you. Same thing for the inner thigh. You can stand here and go into a bit of sideways lunge. Okay, so in this case, you would just be basically going through that. So if you want to give that a shot, okay, here, and you're maintaining good posture here, holding the stretch. Now, when we're going through all these stretches, you want to make sure you're holding them so you can come back up. You want to make sure you're holding them for at least 30 seconds. 1 or 2 second stretches are not going to give you increased flexibility over time, okay? And we do have to remember that a lot of the stretching we do can go away in 20 minutes if you don't continue to do dynamic warm-up, okay? So we've now done the hamstring, the inner thigh, now we want to do the front. So the front's going to be going into a lunge position. Okay, drop down your knee to the floor. What you're going to do is keep your body upright, and you're going to push your pelvis forward. And you stop when you feel the stretch in the front of the leg. So do you feel the stretch there? If it gets a little bit too awkward on this leg, you can always step this leg out a little bit further. Same thing. What you want to do is make sure you're holding this for a minimum of 30 seconds. And just so we're aware, because I know we all watch YouTube videos, the stretching does not need to hurt. Okay, you're just kind of going into a range where you're feeling the stretch and then holding it. And then coming back out of it. Now the last one we want to do, which is to stretch the muscles on the side of the hip so you can go on your back. We call this a figure 4 stretch. Okay. Here you're just going to cross this leg across the other one. So this ankle is sitting on your knee. You bring this leg towards you and you go to the point until you feel the stretch on the outside of the hip. Now there are a lot of other stretches you can do. We're just trying to cover everything that'll get the front, the back, the inside, the outside, and some of the hip rotators. One of the things I want to mention that we didn't really discuss in the flexibility section is it's a pretty basic stretching program. We do have a more advanced stretching program on Chair District on the YouTube channels, which we'll go over if you're a flyer and you need to do scorpions and bow and arrows or to work on your toe touches. So I would just jump on over there if you want to take a look at better ways to increase your flexibility. For this video, we're just trying to make sure that everything seems to be fairly balanced. So it's not really about performing your skills, it's about making sure that the hip is fairly balanced from a flexibility standpoint.
Awesome. So now we're going to talk a little bit more about strength using our resistance bands. So can you tell me a little bit more about that?
Okay, so this gets a little bit more involving because we've got 4 directions to move in. But then we've got 4 rotational directions to work in. So maybe what we'll do is let's just start with the simple movements first. So if you just put that around your ankles. Okay. So the first movement I want you to do here is we want to strengthen the outside of the hip. The resistance of the band, I want you to be able to do at least anywhere from 6 to 10 repetitions. Now, if you're on the Chair District app, all of this stuff is, you're being told what to do, but for today, it needs to have a little bit of difficulty to it to make sure that you're actually generating strength, but not so hard that you're doing the movements improperly. Okay, so this first one is just to balance on your left leg, and you want to push the right leg out without leaning your upper body over. And then you're going to notice that you will feel some on that left hip and on the right ankle because it is supporting you, and that's okay, it's just a little extra work. Okay, and then you do the opposite on the other side. Now to you, does one hip feel stronger than the other?
Yes.
Yes. Okay. You feel better with the left hip?
Yeah.
Okay. So those are things that we want to make sure we're addressing, that we make sure that we are developing equal strength on each side to help reduce the injuries. Now the next 2 are going to be fairly similar. This one's going to be pushing forward so that we're moving the muscles in the front of the hip, and the quadricep muscles that cross the knee joint will also be involved here. And we won't do the other side right now, but now you're just going to kick back. Try to keep the toe facing forward as you go back so that you're not rotating. You can get into different angles of the foot if you want to make this more advanced, but right now this is all we need to worry about. Okay, now you're going to need assistance from this point on. So if you have like a table leg or some type of post to put the TheraBand around, we want to use this to start working on the inside of the leg. So same thing, you're still balancing on the opposite leg, pick up the right leg and you're going to squeeze it towards the other one. This works the inside of the leg. So basically these are the pretty simple movements. You got out, in, front, back. Now we want to actually start working on some of the hip rotators. So here you're going to bend the knee. Try to make sure this thigh doesn't go out in front of the left thigh, so the right thigh and the left thigh should remain the same. You're going to think of spinning here. Your hips should not move. You're just going to rotate here, so the ankle will come towards me, and then it'll come across you without moving your hips. Okay? And this seems a little bit strange, but this is actually external rotation because your thigh is turning out. Don't get confused with the foot. Now I'm going to go to the other side. Okay, and this is going to be internal rotation. Same thing, no moving of the hips. And once again, this TheraBand would be attached to either somebody helping you or to a pole. The last one we're going to do is a little bit more difficult for balance. You can do this just lying on your back, where you would just bring your knee up a little bit. Here we're going to force her to balance and make this a little bit more challenging, but now you're doing rotation again. So rotating in, try not to lift that hip, keep everything still. I'm providing the resistance. Okay, and then I'm going to slide across in front to do the opposite one. And for now I'm holding on to her, but you wouldn't have somebody holding on to you. If you can't do the balance, you would just lie on your back to do this exercise. Okay. So now this covers all the movements for the hip, from adduction, abduction, in, out, front, back, and all the rotational movements that the hip can do.
And lastly, we have to talk about power. So how do we get that involved into all of the rest of the things?
So we remember, so we just worked on strength. So power is, just a reminder, power is doing a strength movement with speed. Or some people will be familiar with it being a plyometric exercise. We want the hip to be more involved, because a lot of these exercises you will have seen that we did when we were working around the ankle joint. The only difference going to be here is I'm going to want you to have a deeper knee bend when we do some of these activities. So let's just keep things simple first. One of the big goals is we want to make sure we're developing power individually, so one leg at a time. So let's just do a squat jump on one leg. So your hands can be on your hips, or you can have them free. And then you're going to actually squat down as if you're sitting in a chair, and then explode up, and then just land, and then explode up. Now to get more advanced, you wouldn't stop in the bottom. You would just do it continuously. But for now, you can just stop in between each one. Every jump that you do here should be maximum effort, right? Okay, so now that's up and down. So you can also do the same thing like a standing long jump, single leg. So if you just stand on one leg, and then you would jump towards the camera. Want to try that?
Okay.
And then just try and, so you're jumping up and out, get into a little bit more of a squat, come backwards, yep, okay. Do the same thing, a little bit more of a squat, because we want to get the hip involved a bit more. There you go, and then land and sink into a squat.
Whew.
Okay. You can do that backwards, but it gets a little bit more difficult. Do you want to try one? No, okay. So you can, it would just be the same thing. You would dip into a squat, go backwards and watch your landing, but it gets a little bit more dangerous if there's things around you. The last one that we would do is jumping to the side. So if you want to come over here, you would stand on, let's just stand on the right leg. You would do a squat down, and in this case, I want you to land on the other leg and go into a squat. And then you would practice going further and further, because we're trying to get a lateral movement in here.
Okay.
Got that?
Yeah.
And then let's just actually show them doing a squat jump with getting into as if you're sitting on the chair, and I want this to be continuous, okay? And in this case, let's use the arms, so we show people how to do this. So as you dip down, your arms would go down, and then you would explode up and reach with your arms. In this case, I find it's okay to use the arms because we're not really concerned about left side, right side. We've taken care of that with the single leg activities.
Thanks for watching. Next episode, we'll be talking about jumper's knee and
Hodgkin's disease.
whatever that is.